So my name's Jenny and I'm going to share the patient story for my father-in-law Nev, who had Alzheimer's disease and was admitted to Huddersfield Royal Infirmary at the end of last year. So I'm married to Tim and we've been retired for 6 years, and we've spent the last 20 years of our lives supporting and caring for our parents, 3 of whom had dementia. So Nev was diagnosed with Alzheimer's disease around 2016. Nev lived at home on his own with lots of support from ourselves and other organisations and agencies. So he had carers going in at breakfast time and tea time to help him get dressed appropriately for the day and get ready for bed at night and give him his tea. So every day, Nev went out of the house somewhere, unless he was poorly with a chest infection or under the weather. He used to do wedding photography. He was an accomplished artist and had lots of his own paintings all over his house and around ours. And he enjoyed gardening and walking. As a young man, his profession, much to everybody's amusement when he told them about it, was as a chick sexer. He loved spending time with his grandchildren and their partners. So Nev's recent history was that apart from having Alzheimer's, he was a bit unsteady on his feet and he intermittently had mild lymphedema on his legs. But other than that, he was well. And as I say, lived at home and lived a very full and happy life. He became a bit unwell early in October with a urinary tract infection, and then he subsequently, over the next 6 weeks, had a couple of falls. In the middle of November, when he had another fall, it was clear that he was not able to weight bear on his left leg, and then we ended up waiting 9 hours for an ambulance. So we organised for a wheelchair taxi and managed to manhandle Nev onto the stairlift and into his wheelchair to get him to A&E. Was admitted to the same-day emergency care ward in the early hours of the morning, and then subsequently went to a number of different wards. He was on one of the care of the elderly wards. But looking at the differences that we experienced when Nev was eventually admitted to the care of the elderly ward. So the staff on the ward here, they were calm, competent, compassionate. And as a carer, I felt completely reassured that when I wasn't there, that Nev was actually being cared for and looked after properly. I felt the staff on the care of the elderly ward knew what they were doing. They were very welcoming. They went out of their way to make us feel that we were important as carers. Even though we were going out of visiting hours as carers, we never felt like we were in the way. And we felt that nothing was too much trouble when we asked for anything for Nev. We felt that they made an effort to keep us informed and updated, and on the whole, the communication was very good. The ward, even though it was very busy, it always felt calm and it felt like things were under control. Though I didn't meet the ward manager initially, it was very clear that the ward was well led. Even when she wasn't there, you felt that all the staff had the same goal and the same high standards. As a family, we felt listened to. Again, very simple things about the importance of Nev being dressed in his own clothes and sitting out in a chair so that he didn't feel poorly, so that he felt like it was more his normal routine. Things like listening to us about what he drank out of, that he didn't drink out of a spouted cup, he drank out of a normal cup. And one of the really sort of big things that I was very impressed about was on this ward, they had boards above the bed that I was asked to fill in, looking at what Nev liked, what he didn't like, what he did normally, what he was able to do. And not only did I feel that they were then interested in what the usual Nev was like, rather than the Nev who was in front of them poorly in a hospital bed, but it also made me feel very involved as a carer. And they were clearly more dementia aware. They got straight away the fact that Nev couldn't use a call bell. It doesn't matter how near you put it to his hand or how many times you told him how to use it. With his type of dementia, that wasn't something that he was familiar with, and he would never use the call bell. He was offered drinks even when he said, he didn't want them. They realised to sort of frame it in a different fashion and encourage him to drink appropriately. So the differences for Nev on the care of the elderly ward as well as us were immense. As I mentioned previously, I felt like the staff understood dementia. They were able to engage with him properly, they were friendly and professional, and obviously he responded appropriately because they were talking to him in a manner that he understood. Whenever we visited, Nev looked clean, he was shaved and dressed appropriately. He was even given baths and showers. On the care of the elderly ward again, he was quite confused at times, so just a normal chair wasn't appropriate because he'd slip out, but they'd managed to find chairs that he could actually be reclined in and be left safe to sit in. They also understood that he got tired, sat out in the chair, and were able to coordinate these sessions so that he was sat out in the chair at meal times where he was able to actually eat and drink appropriately. Were asking us about Nev's usual routine and what he needed to do to manage at home. So they actually understood that that's what our end goal was, that we wanted him at home. And how did he need to improve, or what did he need to be able to do so we could manage him at home? And simple things like that make a massive difference to us and also Nev, even though he couldn't say it at the time. I think it's being aware that the simple things really are the most important to. At 90, everybody's different. Nev certainly was.